Marty Misek was always an active guy, swimming, running, biking. He even earned a 5th-degree black belt in the martial arts. But as he got closer to 40, the pain in his hips was so bad, he had to give it all up.
My quality of life was going downhill slowly every year. The pain was immense, and it was there all the time. It never let up.
Marty went to see his doctor, who told him he needed a total hip replacement. But since a total hip replacement only lasts 10 to 15 years before it wears out and needs to be done again, his doctor told him to try to manage the pain and wait at least 10 years before having the surgery.
I was trying to fight this from getting worse, exercising, and it progressively slowly got worse. And every year I got stiffer, the pain got more intense. I got to the point where I didn't want to walk as much, stand as much. Well, my wife, one of the teachers she works with, husband, went and had this hip surgery done. It was a new procedure. I'm like, we need to find out about this. And they came back and told us it's a Birmingham Hip. This is what they do. They don't do a total replacement. It's a partial. You'll be able to be active. I'm like, wow, I need to go talk to this guy.
After learning more about Birmingham Hip Resurfacing, Marty went to see Dr. Phillip Schmidt at Huron Valley Sinai Hospital. Dr. Schmidt has performed more than 1,000 resurfacings and is the most experienced Birmingham hip surgeon in the state of Michigan.
When we're talking about resurfacing the hip rather than replacing the hip, what we're doing basically is we're shaving off all the spurs, saving as much bone as possible, and then capping the femur bone like we're capping a tooth, really, and then putting in a cup in the pelvis like we would for a total hip. And then that's your new joint. I've got a little water in here just to show you how it glides, but basically this is designed so that when you're moving your hip, your joint fluid gets in there and this hydroplanes, and so the metal's not touching the metal, and that's why it lasts so long. So the more active you are on it, the less it wears, which is, totally revolutionary compared to a metal on plastic total hip, where every move is causing a micro amount of wear every time. People are basically pain-free the next day in terms of the pain they had before. I mean, obviously there's some soreness involved with the muscles being moved around and things, but they're not rubbing anymore. They're not irritating the nerve that goes right over the front of the hip anymore, so the groin pain goes away.
The projected lifespan of the Birmingham Hip Resurfacing is about 30 years, which means someone in their 40s or 50s who gets the procedure may never need it again, or may need it only once more in their lives. It's ideal for those who are less than 60 years old and who live active lifestyles. Patients who undergo the procedure are able to return to their normal activities, such as skiing, biking, swimming, even the martial arts.
I feel great. My hips feel like I'm 20 years old again. I can't believe it. It's amazing to me.
Dr. Schmidt says that many people are getting total hip replacements when they could actually be more successful with the Birmingham Hip Resurfacing. To learn more about this procedure or to schedule an appointment with Dr. Phillip Schmidt at Huron Valley Sinai Hospital, log on to dmc.org or call 888-DMC-2500. I'm Emery King.